My name is Sean Francis. I work at the Parma Hospital Emergency Department. I'm a physician assistant. I'm 52. I felt really weak and kind of achy all over and painful. Felt a little chilled. That night I went home and my wrist pain was so bad in my wrist I couldn't go to sleep. So I took 800 milligrams of Motrin, went away to a point and I fell asleep. I woke up the next day. I had a fever, 101.5, and I felt, okay, I guess I have the flu. And then the following day was Christmas Eve. I woke up and I actually felt pretty good. But my friend had texted me saying, you really can't go out of the house with influenza. You shouldn't really go to your family gathering for Christmas Eve. So I went home and made some dinner and sat around and started to get wrist pain. It felt like somebody was taking a knife and just jabbing it into my wrist. And my symptoms got worse and worse and worse. And I started to get numbness in my whole arm, started to go up into my jaw. So then I took the 800 Motrin. Nothing changed. It actually got worse. I felt my heart rate, it was beating, pounding fast. I took my blood pressure and my blood pressure was like 195 over 120 and my heart rate was 110. So I said, oh boy, that's not right. And on the way in I called the ER because that's my family. I've lived there, 20% of my life is there. And the nurse had answered. I said, Kristen, I'm having chest pain, I'm going to come in. And she said, we're ready for you, just come in.
The pager went off, so took off to work and ended up being a young guy. Found out it was a PA who worked here, which added a little extra tension. Everyone gets the same care, but it just makes it a little more intense when it's a member of family, someone you work with.
He got a good EKG. He didn't like the looks of it, and he looked at me, he goes, this is a STEMI. I go, it's a STEMI? And he said, this is a STEMI.
So a STEMI means that somebody is having a heart attack. It indicates that the artery is completely closed, essentially. This is a heart attack, and it's happening now, and it's something that needs to be addressed immediately and not something that can be addressed at a later time.
And I just was so nervous, but the one thing I noticed is everybody was really calm, really confident, and I felt really comfortable.
We know that the sooner you could establish blood flow, the more likely you are to not have damage to your heart. So that's called door to balloon time, and it's something that we're just really, really great at here. We do a good job with.
We have a very well-oiled system here in that the patient was already brought over to the cath lab here. He's taken care of by the emergency physicians and by our house physicians here in the meantime. So I walked in and Sean was already on the table, and I scrubbed in and began to do the procedure at that time.
And he very calmly with his arms crossed said, you're gonna be okay. He had his hand on my shoulder, and then I was kind of restless, so he just held my hand as the meds were being given. I remember that.
Most of the ones I've seen have been 60 minutes or less in many cases. It depends. If we're already in-house, they happen within half an hour to 40 minutes often. So our times are very, very impressive.
When all this was going on, I felt I was in denial about it. I felt it couldn't happen to me, even though I knew my mother had a problem, my grandfather had a problem. I had a cholesterol that was elevated, so I had risks, but I couldn't believe it. I think the thing that was the most profound for me was feeling okay again. Not having the wrist pain, not having the anxiety related to whatever symptoms I was having. I actually felt like a guy that was just normal, that, I felt normal so fast it just didn't seem real.
What we do is what we do. People come in, they're having heart attacks, and we take care of them. So it didn't really stand out that's what we do all day, all the time, and we're good at it.